a large variation in the extent of the rhinoplasty procedure, because every patient is different. Every patient has a different nose, a different shape, a different style, different anatomical elements, and also you have to consider whether there's just the profile or the airway. So it's a very individualized consultation and procedure. Some patients need a tiny adjustment, other patients need quite a big reworking, and of course, sometimes I have patients who've had multiple procedures before. Well, I would say there's two sides to that. There's the more obvious side, which is if there's a septal deviation or trauma to the nose, then of course it's necessary to help with the airway and the function of the nose. And the function of the nose is not just in breathing, but also, humidification of the air. There are other structures inside the nose that help in the function of the nose. So all those things can make it medically necessary. Of course, every medical intervention has an aesthetic component. Usually, for example, on the NHS, these days, we are only allowed to do functional surgery for the nose. And so if patients would like to have a change in the profile, that really needs a different approach. I've got training in both because I used to work alongside an ENT surgeon for 10 years, and I do children with cleft lip and palate, and they all tend to have a bent septum, so they all need surgery. Rhinoplasty is one of the hardest things to do in plastic surgery, so it does need quite a thorough grounding to be able to get the experience to do it well. Now, sometimes, even though it's only a functional element you want to treat, that's to say, there's a deviation or blocked airway, sometimes the trauma is so great that you have to do an aesthetic element because the whole shape of the nose is deformed. And the other thing I will say is even in minor injury, it doesn't tend to get better. As the years go by, it tends to get a little bit worse every year. So you have to bear that in mind when advising the patient. Again, we have to separate septoplasty, which is just the septum inside the nose. If it's deviated, that may not change the profile. So that's for functional rhinoplasty, but there are other structures in the nose that may need adjustment to improve the function of the airway. The main approaches that we have tended to consider is whether the rhinoplasty is open or closed. With a closed procedure, all the scars are on the inside. With an open procedure, all the scars are on the inside except one, and that is just on the undersurface of the columella, the partition between the nostrils on the undersurface of the nose. Now, there are proponents of both, and for many years I've done both types. So I tend to do an open one when I need to look directly at the structures because it's complicated, and so you're more accurate to be able to do that. But if it's a more straightforward procedure, then yes, of course, you can do it closed. But I have to say that to be able to do a good rhinoplasty closed, you have to have done quite a lot open, because sometimes a closed rhinoplasty is almost by feel. You can see things, but you're judging things a lot by feel. So you have to have that experience to be able to do it well. Those are the two main types. There are always new little adjustments and little subtitles of new ways to do the procedure. The most recent one is kind of a conservative type, where you leave the bridge of the nose alone and you drop any bump by manipulating structures deep to the bridge, which means that the original front edge of the nose remains intact. So those are the main types, I would say. Yes, again, it depends on the complexity. So if you're having a very straightforward, I mean, no one is standard, I would say to you, because everyone is different. But the classical reason for requiring a rhinoplasty or requesting it is if the nose is a bit large, if there's a bump on the nose, or there's an asymmetry, or it's out of proportion. And if there's no problem with the airway, then certainly those sort of procedures, albeit it needs meticulous attention to the actual surgery, can be done as a day case, sure. Again, that will depend on how extensive the procedure is. So you go from a simple removal of the hump and trimming and reducing the size of the tip and just making the tip more pert. So you will have a dressing or a splint on the outside of the nose for a week. The bruising can last, a couple of weeks. But for a modest rhinoplasty, you might be able to be back at work at 10 days to 14 days. More complex surgery, you probably want at least 2 weeks off. And then the most complex, I did one last week where she'd already had 4 operations. And so she needed to have rib grafts to reconstruct everything. Now, obviously, that's going to take a lot longer to recover, but even she will probably be back at work at 3 weeks.